In this video, we send to you Warning, Introduction, Learn the Causes, Measures to Prevent and Treat Diabetes. Let's go! Part 1. Warning about diabetes. Diabetes not only affects the quality of life, but also causes dangerous complications if not controlled.
Acute complications. Hypoglycemia or hyperglycemia can cause coma or death.
Chronic complications, including cardiovascular disease, kidney failure, eye damage, diabetic retinopathy, and nerve damage leading to amputation. Economic impact. The cost of treating diabetes and related complications places a heavy burden on families and society. Early detection and treatment, combined with a healthy lifestyle, can help control the disease effectively and prevent complications.
Part 2. Introduction to diabetes. Diabetes mellitus is a chronic metabolic disorder characterized by persistently high blood sugar levels because the body does not produce enough insulin or does not use insulin effectively. Insulin is a hormone secreted by the pancreas that helps regulate blood sugar levels. Diabetes can lead to many serious complications if left uncontrolled, including heart damage, kidney failure, blindness, and nerve damage. Diabetes is divided into 3 main types.
Type 1 diabetes. Due to the immune system mistakenly attacking insulin-producing cells in the pancreas, it often occurs in children and young adults. Type 2 diabetes, most common, associated with insulin resistance or relative insulin deficiency, commonly seen in adults, especially those who are overweight or obese. Gestational diabetes occurs in pregnant women and usually disappears after giving birth, but increases the risk of developing type 2 diabetes later in life. Diabetes affects millions of people worldwide and is rapidly increasing in the United States due to modern lifestyles and unhealthy diets. Early recognition, prevention, and treatment are essential to minimize the impact of the disease. Part 3. 10 main causes of diabetes. Here are the 10 main causes of diabetes with a detailed analysis of each cause. 1. Genetics and family history. Analysis. If someone in the family has diabetes, especially type 2 diabetes, the risk of developing the disease will increase due to genetic factors that affect the ability to produce or use insulin. Genes associated with type 2 diabetes often affect beta cell function in the pancreas or insulin sensitivity. For example, a person with a parent or sibling with type 2 diabetes has a 2 to 3 times higher risk than a person with no family history. Number 2. Overweight and obesity. Analysis. Excess fat tissue, especially visceral fat, causes insulin resistance, making it difficult for the body to use insulin effectively. Obesity is the leading risk factor for type 2 diabetes, especially in people with a body mass index, BMI, over 25. Example: obese people are 7 times more likely to develop type 2 diabetes than people of normal weight. 3. Unhealthy diet. Analysis. Consuming too many foods high in sugar, saturated fat, and processed foods increases blood sugar and puts pressure on the pancreas. Lack of fiber and balanced nutrition also contribute to increased risk. For example, drinking lots of sugary soft drinks or eating foods high in refined carbohydrates, candy, white rice, increases the risk of insulin resistance. 4. Lack of physical activity. Analysis. A sedentary lifestyle reduces the body's ability to use glucose efficiently, leading to a buildup of sugar in the blood. Exercise increases insulin sensitivity and improves glucose metabolism. Example: people who work in an office and are sedentary are at higher risk of diabetes than those who exercise regularly. 5.
Metabolic syndrome. Analysis. Metabolic syndrome includes factors such as abdominal obesity, high blood pressure, high triglycerides, low HDL, and insulin resistance. These factors significantly increase the risk of type 2 diabetes. For example, a person with a waist circumference greater than 90 centimeters, men, or 80 centimeters, women, is at high risk of metabolic syndrome and diabetes.
6. Chronic stress. Prolonged stress increases the secretion of cortisol and adrenaline hormones, disrupts glucose metabolism, and reduces insulin sensitivity. Stress can also lead to unhealthy eating habits. For example, people who regularly work in high-pressure environments or suffer from insomnia are at higher risk.
7. Endocrine disorders. Conditions such as polycystic ovary syndrome (PCOS) in women or hyperthyroidism can increase insulin resistance, leading to diabetes. PCOS is particularly associated with type 2 diabetes due to hormonal disorders. For example, women with PCOS are 4 to 7 times more likely to develop diabetes than women without the disease. 8. Age. Analysis. The risk of type 2 diabetes increases with age, especially after age 45, due to the decline in pancreatic function and decreased insulin sensitivity. However, type 2 diabetes is increasing in young people due to modern lifestyles. For example, people over 45 are at higher risk, but obese children can also develop the disease. 9. Long-term medication use. Analysis. Certain medications, such as corticosteroids, such as prednisone, antipsychotics, or HIV medications, can increase blood sugar and cause insulin resistance when used long-term. For example, patients taking corticosteroids to treat chronic arthritis may develop diabetes as a side effect of the medication. 10. Gestational diabetes or having a large baby. Women who have had gestational diabetes or have given birth to a baby weighing more than 4 kilograms are at increased risk of developing type 2 diabetes later in life. Gestational diabetes increases insulin resistance during pregnancy. Women with a history of gestational diabetes are 7 times more likely to develop type 2 diabetes within 5 to 10 years after giving birth. Part 4. Measures to prevent diabetes. Based on the above causes, here are effective preventative measures. 1. Maintain a reasonable weight. Lose weight if overweight or obese, especially reduce belly fat. Aim to lose 5 to 10% of body weight can significantly reduce the risk of diabetes. For example, exercise 30 minutes a day, walking, jogging, yoga, and control food portions. Number 2. Healthy diet. Increase green vegetables, low-sugar fruits, whole grains, and high-fiber foods. Limit refined sugar, saturated fat, and processed foods. For example, replace soft drinks with water or unsweetened tea. Eat brown rice instead of white rice. 3. Increase physical activity. Exercise at least 150 minutes per week. Brisk walking, swimming, cycling. Combine aerobic and strength training to improve insulin sensitivity. For example, walk 10,000 steps a day or join a gym class. 4. Manage stress. Practice relaxation techniques like meditation, yoga, or deep breathing. Make sure you get 7 to 8 hours of sleep each night. For example, spend 10 minutes a day meditating or going for a walk to reduce stress. 5. Regular health checkups. Check your blood sugar and related indicators, blood pressure, blood lipids, regularly, especially if you have a family history or other risk factors. For example, people over 45 years old should check their blood sugar every 1 to 2 years. 6. Avoid medication abuse. Consult your doctor when using medications that have the risk of affecting blood sugar, such as corticosteroids. For example,
If you take medication for a long time, ask your doctor to monitor your blood sugar regularly.
Part 5. Diabetes treatment. If you have diabetes, your treatment needs to be individualized and coordinated with your doctor. Here are the main methods. 1. Lifestyle changes. Continue to maintain a healthy diet and exercise regularly to control your blood sugar and reduce the risk of complications. For example, use a low glycemic index (GI) menu, such as vegetables and lean proteins.
2. Medications. Medications such as metformin, sulfonylarias, or DPP-4 inhibitors may be prescribed to control blood sugar. Insulin is used in severe type 1 or type 2 diabetes. For example, metformin is often the first choice for type 2 diabetes.
3. Monitor your blood sugar regularly. Use a home blood sugar meter to monitor and adjust your diet and medication as directed by your doctor. For example, measure your blood sugar before and after meals to evaluate the effectiveness of your diet.
4. Treatment of related diseases. Control blood pressure, blood lipids, and cardiovascular risk factors to prevent complications. For example, use antihypertensive drugs or statins if indicated. 5. Education and psychological support. Participate in diabetes education programs to better understand the disease and how to manage it. Psychological support helps patients cope with the stress of chronic disease. For example, join a diabetes support group to share experiences. Diabetes is a serious health problem, but it can be prevented and controlled through a healthy lifestyle and timely treatment. Understanding the causes, from genetics to lifestyle, helps us develop effective preventative measures. If you already have the disease, adhering to treatment and making lifestyle changes will help minimize complications and improve your quality of life. Take action today to protect the health of you and your loved ones.